Coming up over the upcoming holiday weekend here in South Korea is World Mental Health Day. The COVID-19 pandemic forced people to isolate, exposing many to mental health risks. And a new term was even coined here in South Korea, Corona Blue, to describe those feeling depressed due to the lack of social activities during lockdowns. And while life for many is returning to normal, current events in the world would hardly put a smile on faces with war, climate catastrophes, and spiraling inflation. So how can we as a community work to improve our mental health? Let's connect with Dr. Elizabeth Schnobrick, a licensed clinical psychologist from Minnesota. Good evening to you.
Hello, thank you.
How has World Mental Health Day and associated events contributed to global efforts to tackle the mental health stigma and indeed put the spotlight on mental illness?
Yes, I think that the most important impact of World Mental Health Day is information. And I believe information is power. In order to end the stigma of mental health worldwide, we need to be providing accurate information to everybody that mental health is a problem that affects many, many people in this world. And most people know somebody who is affected, and they may not even realize it.
Right, and let's talk about what the community can do. What can a country provide or do for its people when it comes to mental health?
Yes, I think there are many things that a country can do. First and foremost is to work as a country to make it a priority to end the stigma. It's so crucial that a country work together to stop hiding and stop pretending that mental health isn't a problem. One of the things that can be done is creating policy that prevents businesses from discriminating against somebody with a mental health issue. Another thing is to create a public campaign in order to educate the public on what are signs of mental health, where can someone go to get help, and the importance of getting help. I think another thing that would be really important is recognizing that the more we keep mental health quiet, the more we increase the likelihood of somebody feeling that there is no other option other than suicide. And being able to talk about these things openly and publicly is really the first step in changing what's becoming a worldwide health crisis.
Right, and being able to talk about it, like you said, for someone to do that, the individual has to realize what's going on, right? And you've also worked with a lot of South Korean patients throughout your career, and often individuals might pass off behavior patterns in family or friends as they just simply not being they might just look at it as they're not in a good mood. What are some signs or signals that might identify that a person is actually in a need of professional help to deal with mental health issues?
Yeah, that's an excellent question. And I think one thing, in addition to looking for the warning signs, is not being afraid to ask the questions, not being afraid to feel like you're bothering someone or burdening them, but really, if the person is acting concerning and some of the warning signs I'm going to list may be present, to be sure to ask those questions and not wait. So some of the things you can that you might notice is being sad or moody for long periods of time, longer than 2 days or 3 days, usually upwards of 2 or more weeks. A sudden calmness after a period of being moody or sad or depressed. Withdrawal from others, withdrawal from activities that were previously enjoyed, changes in personality, changes in sleep patterns. They may be sleeping longer, sleeping less. They may change their appearance. They may stop caring what they look like. They may stop showering regularly, may wear dirty clothes, stop worrying about hygiene. They might engage in potentially dangerous or risk-taking activities. They could have had a recent trauma or life crisis such as divorce, loss of a loved one, loss of a job. They may be talking about feeling hopeless, feeling like they're a burden, feeling like they don't have a reason to live, feeling trapped, feeling stuck. They may make preparations. They may actually start giving away items. They may be talking about death. They may have written a suicide note. They may actually threaten suicide. They may actually say those words that they're feeling like they have no reason to live or that they might as well die. These are all potential warning signs. And if any of these warning signs are present, or if there's even a hint of a concern, it's always best to err on the side of caution and ask the question and talk to the person and not be afraid to ask.
Right, and I think it's all very important for everyone to know so that we can all help each other. Well, thank you so much for your time, and I hope you have a great evening.
Thank you. Thank you for having me.